right now, 30% of calls are going unanswered. Now we look at the marketing calls. So that means if someone's spending $10,000 on marketing, $3,000 is going down the drain on the top of your funnel. So before they even think of a marketing funnel, so before they even get into the funnel, they're going to spill out over the top. You guys are seeing the same thing. How are you guys helping people fix that?
Yeah, and it's a really interesting conversation. And to explain a little bit more about the data that Gary and I both see, 32% on our side is the average missed percentage of inbound patient phone calls. Mm-hmm. And the common misconception is those are the examples of people calling in without a tooth at 6:30 in the morning. That would actually be an outlier in the data. A majority of the missed calls actually come during business hours, and they come in 2 or 3 major peaks in a typical business setting. That is just when the business is opening up, that 8 to 9:30 range, that lunchtime range, and that end of the day range. And why those add up, there's 2 reasons. Number one, we're just getting into the dental office. We're just getting teed up on our morning activities. We're holding our morning huddle. And because of that, we're occupied. And so when the phone rings, we may not be able to get to it. Or lunch, we are down team members. But guess what? When people are calling at 8 in the morning or 12, it's because it's during their lunch break. It's during their call in. And that's the perfect storm that's created within dental is we're taking our breaks when people are also taking their breaks, which then means we are harder to reach as a practice. So we need to create systems and be aware that people are going to call on their drive into work, their drive home from work, and during their lunch break because they have the 15 or 20 minutes needed to schedule or do what they needed to do. And we need to cater to that to grow our business.